October is Breast Cancer Awareness Month. Knowing your risk is an important part of preventing or at least greatly reducing breast cancer. But how much do genetics play a part in the risk? Here today to talk about genetic testing, we have Sanford genetic counselor Megan Reardon. Thank you for coming in today.
Yeah, thank you for having me.
All this month, we're visiting with the experts over at Roger Maris talking about breast cancer, and genetics and genetic testing has just really been a hot topic over the last couple of years. What do genetic counselors do, and how do you work with patients?
Yeah, so genetic counselors play two main roles. We help patients assess their risk for disease, and we also provide support when necessary. So the genetic counselors at Roger Maris Cancer Center can help determine someone's risk for breast cancer. We can assess personal risk. We help guide people through the genetic testing process, determine other family members who might be at risk for inherited diseases as well, discuss management, and we can also help with emotional support for people.
I was kind of wondering that as well. Sometimes it is great to know, but sometimes knowing can also add some different emotional, issues that you might not have had. Do you see that?
Yeah, it can be a lot of anxiety for people to find out that they might be at a higher risk for certain diseases, and we can not only help them do that management and surveillance, but help them understand, how that really impacts them and help with those emotions.
Could we talk a little bit about what part genetics actually does play as far as what risk level they're at then? I mean, how much has the science really, advanced that you know what your chances are?
Yeah, the science is advancing a lot. Most breast cancer does just happen by chance. Only about 5 to 10% of breast cancer is hereditary, and there are many different genes that are associated with that increased risk. And for example, the BRCA or BRCA1 and 2 genes can increase a person's risk for breast cancer 4 to 7 times the general population. And when people carry these mutations, it can also increase the risk that they would have breast cancer at a younger age or would be diagnosed with breast cancer more than once, like bilateral breast cancer. And these mutations can be carried by men and women and can increase the risk for other types of cancer, such as male breast cancer, ovarian, prostate, colon cancer.
Interesting. So are there any red flags that you should be, watching for when you think about your own family history and knowing your family?
Yeah, there are several things we look for in a family to determine if we're suspicious that it could be hereditary. Those include people diagnosed with cancer, especially young, like under the age of 50. We'll see cancer in multiple generations of the family. People with more than one type of cancer, so people with bilateral breast cancer. Rare cancers in a family, which include ovarian, pancreatic, male breast cancer, and then certain groupings of cancers, so like multiple people in the family diagnosed with like the same type of cancer.
What does genetic testing entail? Because yes, for sure I want it, but what am I going to do when I go in?
Yeah, the process, we do recommend that people meet with a genetic counselor before pursuing testing. And so at Roger Maris, a genetic counselor would meet with someone to look over the family history and their personal history and discuss what their risk might be. The test itself is just a simple blood draw. So if we determine that someone is, that testing is indicated, then we'll order that. And the test results take up to 3 to 4 weeks a lot of the times to come back. You may meet with a genetic counselor after the results come back to discuss them, and the results can be used to help optimize care.
Okay, and first things first, maybe just start by talking to your primary care provider as well.
Yes, we would recommend discussing with your primary care provider if you have a family history of breast cancer or other types of cancer, and they can help determine whether genetic counseling might be helpful.
Okay, Interesting. Thank you, Megan, so much for coming in today and kind of breaking it down for us. It's fascinating. Thank you.
Thank you.
Stay with us. Coming up on North Dakota Today, keeping our pets safe, not only for the upcoming Halloween holiday, but